A patient who's going to get radiation therapy is likely a patient who's been diagnosed with some or another form of cancer. There are some non-cancerous conditions that we treat with radiation therapy, but 95% of people are treated for cancer. So in order to prepare a person for treatment with radiation therapy, the first thing that's going to likely happen after they've been diagnosed and had a lot of other testing is going to be what we call a CT simulation or a planning session. And so what we're entering now is a space that is occupied by a couple of machines that look like this. A CAT scanner in the background. It is a little bit blurry. It's maybe just as well that it's a little bit blurry. There's an actual patient being prepared for treatment through that room. A number of other folks who are part of our support team are helping the patient onto the table. We'll take a picture of them. We'll frequently make what's called an immobilization device, so that as they are going to be treated with radiation treatment, they'll be in a stable position. I'm going to walk you over to the place where people actually get the treatment as we just cross the hallway. So once again, you would have seen a patient come in, say hello to our friendly staff up front. We probably would have seen them in the exam room. The nurses are always helping us. The first thing a patient would have happened to them before a treatment would be this preparation session in the room that I just showed you. Now we're going to walk a little bit to a different area, and I'll show you what an actual treatment machine looks like. So these folks are the radiation therapists who are going to be operating the actual machinery. They work in a sort of control room. It's almost like a little NASA setup, right? So we have a couple of direct visualizations of the patient who would be in the treatment room. And I'll walk you into what that looks like in just a moment. We're required to have at least two separate real-time visualizations. We're now going to walk into the actual treatment machine room, okay? And this machine, the working parts of it are all housed in this gigantic plastic space. The business end of it is what I'm showing you right there. It spins around on what's called a gantry. It's a rotating connection to the wall. What you see in addition to the round business end where all the radiation comes out are some side panels. And those side panels are used for various types of imaging procedures that when a person comes in and is positioned on a table that looks like this, we take a couple of setup check films, and that verifies that the patient is in the proper location. When the actual treatment is being administered, as you can see, Erica is putting the table into the position that it would be for a typical patient, lined up right there. The treatment beam is going to be coming out of that rounded side, and the machine would likely spin as the treatment's being given, and it's directing the radiation from a lot of different directions. The way that works is, so the whole idea is that we are trying to kill cancer with radiation. Radiation has DNA. It prevents the DNA in those cancer cells from continuing to allow the tumor cells to replicate. That's the basic idea. The reason we are going to direct it from a lot of different directions around the patient is that if you can imagine a bullseye in the center of a wall, and let's say we only want to hit the bullseye, and let's say we have 5 or 10 people with high beam flashlights, and we say, all right, direct your beam right at that one spot, and we turn off all the lights. Well, that one spot will be well lit up and not so much light surrounding it. So it's a similar idea with radiation. We're going to have the radiation coming from a lot of different directions. It's going to center on the tumor inside the patient, but not so much radiation is seen by the rest of the surrounding area. So, okay, so I'm going to walk you a little bit. I think I might actually retread an area just because it was so blurry at the beginning. But let's just keep our little walking tour. So we have 4 of those machines in the department, in this department, and walking back down the hallways. I'll show you one little side room that has a little different situation, and it's being used for a patient, but what's going on in that particular room is that we have a type of treatment that's called an implant or an internal radiation treatment. And so what's happened there for the patient who's already lined up in there is that in some cases we like to treat sort of from the inside out as opposed to the outside in. So that particular individual has some special devices that all include a set of thin plastic tubing. And inside the thin plastic tubing, we slide a wire that has some radioactive material at the tip of it. And so as that little radioactive material is passing inside the plastic tubing, it is administering some treatment sort of from the inside out as opposed to from the outside in, like you saw with the other treatment machines. So, okay, we are going to continue the walking path. Now, I mentioned that there would be this process where the patient first had the scan to prepare for treatment and then had some images taken. There are then some folks who are, you say, hi, Estes Park High School students.
Oh, hi.
There you go. She's working at a computer screen that is going to allow her to use some specialized software, which will translate the information about the internal anatomy of the patient that we've obtained from the original scan. So she does something that's in between that first scan and taking the patient to the actual treatment machine. The specialized software that figures out the proper machine settings to use in any particular patient's size and shape. And that's what guides the actual treatment. So we're going to duck in here just because this is just our conference. Hey, say hi, Estes Park High School students.
Hi.
Hi.
Hi, yeah, you guys see these people? So this is, yeah, they're waving back at you.
Oh, good.
That out, yeah. So these are some of my colleagues. What we're doing is our usual morning conference where we are discussing the patients who are coming. This is a group of students who are interested in healthcare professions, and we're giving them a little exposure there. So we talk about patients who are going to be treated. We look at the images that are taken. We discuss the plan, how many treatments they're going to get, et cetera, et cetera. And that's all part of the quality assurance process. So I tried to do that in a, let's say, straightforward linear chronology, but as you can see, I skipped around just a little bit because of the way things were laid out. Ask you about what's the good pathway into radiation therapy?
Yeah, so there's a bunch of different options to go into it. Probably the best way to do it is just find like a program. There's either associate's programs or like bachelor programs, depending on which university you choose to go to. Mine was a little bit, I didn't know this existed. So I did X-ray first, got my bachelor's in X-ray, and then did a certificate program that was a year. To do the certificate programs, you usually need at least an associate's degree though to go on from there.
Radiation therapy. So initially I was in college for something different, and my best friend introduced the program to me. It's a program in Bloomington called Northwestern Health Sciences University, and it's an entry-level program. And so you don't need any prior, you can come straight from high school to do radiation therapy. And it's a 2-year in classroom, 9-month clinical, but they do have more externship programs. So you most likely will be sent out of state to the locations that they have already.
So there are no radiation therapy schools in the state of Colorado. You'd have to go outside of Colorado. And there's really no 1-year programs like for radiation therapy that exist anymore, fortunately. Oh, okay. It's an associate's degree to be a radiation therapist, so at least 2 years. So what I did was kind of similar. And mine, by like 1-year certificate, one was in out like in Tennessee, so not really anywhere close to here. But honestly, if you're planning on already going and doing like a 4-year bachelor's degree, I would just go out of state and do that already. It'd save you a ton of time because there's no reason to go get your X-ray beforehand. That just is what I did because I didn't know this field existed.
Northwestern is, if you have FAFSA, is fully covered by FAFSA. It's a radiation programs typically are going to be a long clinical portion because they want to make sure that you're safe with radiation. So it's about 9 months for my program. Some programs do clinicals throughout the whole thing, but the classroom portion is very important because they want to make sure that you're understanding radiation. So it's going to be a while that you're working with radiation before you actually get the clearance to go and do it. I don't know of any 1-year programs either.
And like I say, just to fill in the gap, since this place was blurry, so this team is rotating through the area that is the setting up or preparation session for treatment. This big machine here is a CT scanner. It's got a few extra bells and whistles on it. It takes pictures of folks, and we could actually put a few other attachments that would allow us to take what amounts to, let's call it a moving picture version of a CAT scan, meaning we not only get an image of the inside of the patient, but also an image of whatever motion there is that while the patient is breathing. Let me see if I can just, if I, do we have any, I'll stand back so you can't actually read the names of any patients, but could we just conjure up any images that you guys just took in the last, either the patient you just took or.
This was a interstitial patient.
Okay, so this is actually the patient. Is that the person getting treatment now this year? Okay. So I showed you that there was that one person who was getting treatment, let's just say from the inside out, so to speak. And so to plan that, we also need to take a picture of their inside anatomy. And what you see there is a side view of that patient's pelvic area. And I'm trying to get just far away so you can't read the name. Can you point, do you mind pointing to the actual stuff that's been placed inside? Yeah, sure. So you can make that bigger, and then do you mind pointing out just a few things? Yeah, so the thing she's pointing to are is an area that's got the devices. That round thing is what's called a Foley balloon. That is there's a tube inside that goes up the urethra and goes inside the bladder, and it is held in place. So we need the bladder to be expanded out of the way. It's moving things out of the way. The place that we're most concerned about in this particular patient is the top section of that area. That you might put your finger right, or at the top of the cylinder thing. Yeah, that's the sort of area that's of concern in this particular patient. That's going to get the most treatment. So that happens to be a picture of someone we're treating, like I say, from the inside out, so to speak. Do you have anybody from like yesterday with a lung, anything like that's easy to pull up? I'll just see if we have one easy other set of pictures that would be interesting to look at. This is a patient that was scanned yesterday. I don't know this particular patient. I don't know. You can just kind of scroll up and down. Was this a 4D?
It is a 4D.
So I mentioned that sometimes we do a sort of moving picture version of a scan. And in this particular patient, we're going to be treating something inside their lung. We're looking in the upper left-hand corner at some cross-sectional pictures. And then, do you mind if can you play the actual pictures? Yeah. We'll take a second, but we'll show you what I mean by, we sometimes use this term called 4D CT scans. I mean, it's 3 dimensions. Everybody knows 3 dimensions, right? They up, down, sideways dimensions in Cartesian coordinates and in life. 4D means you're adding the dimension of time. So you're watching things move through time, so to speak. And if we can find one that's easy enough to pull up within a short period of time, we'll just show you what that looks like. I don't know if you can appreciate that what we see is not just the CAT scan images, but there's some movement up and down with breathing. And so we'll sometimes need to have that information if we're treating some area of the person that is going to be likely moving with breathing. And we can account for that over on those treatment machines in a couple different ways. But anyway, so this is just meant to illustrate what I meant by a 4D CAT scan or a movie version of a CAT scan. And so there you go. Anyway, yeah, so there's a term we use frequently, which is called radiosurgery. And that term was coined a long time ago as a way of representing a specialized niche or a specialized subset of treatments that we do. So the majority of patients who are coming in for radiation treatment are probably going to receive a course of treatment given in small doses over multiple weeks. But sometimes we are in a position to give one big sort of roundhouse punch, if you will, to the tumor using some extra technology. And especially when we're doing that to a tumor in the brain, it's called radiosurgery. And we have a couple different technology platforms to do that. One of them is very much like the machine that you saw us demonstrate up, down, sideways, where The machine rotates around. The particular one we use for that type of treatment happens to be the one in this room. By the way, I hope you know that we play mood music for people while they're getting treatment. So it's almost, I might just ask them to turn it down a little bit. Yeah, this particular machine is the one we do a lot of treatment called radiosurgery. And what you're seeing here are two sections of a plastic mask. And so I mentioned that if we're going to treat a person, we want them to be in a very stable and still position. So in this particular situation, what we're going to do, we've already made this particular mask, which has a front and a back side, because we're going to be treating this particular person's a spot in this particular person's brain. So they're going to be lying down in here. They're going to have this plastic mask on, which is a special plastic that when it's warmed up, it's very flexible. It's kind of soft, like, like wool or something, just like the material in a sweater. And then when it cools off, it firms up, so it holds its structure. But of course, this is positioned over the patient's face, and so there's a lot of holes to breathe, and we can even add a few extra holes if needed. So what we're going to do is we're going to line that person up, and we're going to similarly take some pictures of them to make sure they're in the right place. This other attachment over here is going to be would be repositioned, or something similar to that is repositioned closer to the patient's head. And so from the outside control room area, after we've taken some pictures to identify exactly how much the person might need to be moved to be in the exact ideal position for treatment, then there's some controls out here that can instruct the machine, if you will, to move the few millimeters here and there so that the target is in the bullseye, if you will, and then we can administer the actual treatment. So yeah, so radiosurgery is a specialized form of radiation treatment that is used in very commonly, but it's a couple of specific situations. We treat a lot of patients with different types of tumors. The most common categories of patients whom we treat are the most common tumors that are encountered. So we treat a lot of breast cancer patients, lung cancer, prostate cancer, various intestinal cancers are treated along the way. We're either usually treating people in what's called an adjuvant situation. So they might have had the majority of the tumor removed surgically, and then we use the radiation to mop up what's left, or in other situations where appropriate, we're using the radiation treatment in a so-called definitive setting, meaning that's the main treatment they're going to get. We might or might not add chemotherapy alongside that to amp up the potency of the treatment. And so it's a very interactive sort of corner of medicine where we're often intertwining our activities with other cancer specialists to try to customize and optimize a roadmap of treatment for whatever patient. So anyway, I'll walk over to that space right here. And hey there, don't interrupt. So he's actually doing some actual work here, so I'm trying not to interrupt too much here. Let me pull back and I don't want to mess him up. I'll describe it, and if we can pull up the picture, that's good. So the specialized software we have will upload those pictures of the patient's internal anatomy, and then once we know where that tubing is situated relative to the areas that we're trying to treat with radiation, we have some dedicated software that will then tell us how long to leave the radioactive material inside in order to give the right amount of dose to that spot. I say it will tell us this. I mean, everything is sort of computer controlled, so the software that figures out the right set of timing for the material to be in place is also a package of software that controls the motion of it from a machine. I can't get in there right now. There's a patient right in there right now, but if you can just imagine that in order to be safe throughout the day and not have this radioactive material just spraying radiation everywhere. It's housed inside a very thick leaded container. So it stays for the most part of the day inside that container, very safely nestled away. And it's only when we are giving an actual treatment that we hook up that wire to the plastic tubing, and the machinery inside that controls it and slides it in and out of that space. When we're doing that, all the workers, all the healthcare providers who are involved in that patient's care are going to be stepping outside the room and watching it once again from a couple different video monitors we have. And so the patient is actually behind that curtain in that room, and there's still a few people in there just helping get the setup right. And you already met Dr. Jones, who's still kind of tweaking the controls there, making sure that we are there's a number of built-in, let's call it, well, built-in quality assurance or QA steps that go along. Oh, yeah. Did you oh, okay. So we can actually show a little bit of a visual then now, because this is going to be just a quick visual of some of the software that does show the
No, I don't.
This is Dr. Fisher, one of my colleagues, radiation oncologist, to say hello as the Spark High School students. So this is a visual of some of that software that I just mentioned. And so what you can see in a couple of colored lines there on the screen. Oh, thank you for blowing that out. I'll just get one quick close up. So you see these, so those colored lines represent different levels of radiation dosage or treatment that's going to be administered to that high risk area, the area of concern, the tumor itself. I reversed the camera back, so we're good. When we're giving treatment like that, I think just to use another metaphor like that, is that if we have a bit of radioactive material spending some time inside the patient, inside their tumor, if you will, it will then emit radiation, which is distributed a bit like ripples in a pond. So if you're on the side of a pond and you throw a heavy rock on the inside and it makes a little splash, it's going to make a big splash in the middle. And as you get further and further away, the waves are softer and softer. So it's a lot like that for the internal radiation that we're doing. So if we put it in there and it spends time in a certain place, as you're further and further away, the radiation is absorbed and it's less and less the surrounding tissues. And so we wind up combining, let's say, lots of little rocks thrown from the side of the pond, if you will. So lots of little splashes of radiation along a track that the material will move. And then the summation of all that is the treatment delivery. That's the effective treatment that's being given. And in that particular situation, the main thing that we're using to protect the normal stuff is the fact that there's generally a rapid absorption of the material when it's being given as treatment from the inside out, so to speak. And so by the time it gets to some of the normal structures that we're trying not to give too much radiation to, let's just say the bladder and the rectum, it's mostly been absorbed and it's not so much going to make it to those structures. The fortunate thing we have working for us also is that in general, most normal structures inside a patient are more tolerant and more resistant to the radiation. They have more intact mechanisms to resist it and to repair whatever annoyance they might see from the radiation. Whereas the tumors are, fortunately, in general, a bit more susceptible to the treatment effect because they are usually dividing more rapidly, the individual tumor cells. And so the DNA within them, the molecular machinery, the molecular brain, if you will, of the cell that continues to tell it to divide and keep going and going, it's going faster, but it has, in that sense, it has a bit of an Achilles heel. And so if we injure it, it's a little bit more susceptible to not remaining able to continue to do that replication process. So I hope that all made sense.